Guys, Dr. Dane here. So a big common misconception is that Botox or Dysport or Xeomin or Jeuveau can really only be used in your forehead or in between the eyes, and sometimes around the eyes. Well, that's just simply not true. There are a lot of other places in the face that you can use it to give you a really good look, and today we're going to go through a lot of those with you. Botox was used for the forehead lines, the frown lines, which you can see there in between the eyes are called the glabellar complex, and the crow's feet, which are around the eyes. There's actually a couple other places you can do it as well. So the first part is the nose area, or the bunny lines, the nasalis. Then we're going to talk about the gummy smile, get into the lines around the mouth and the marionette lines, or where you start getting into the area where the jowls are showing. And then we'll start talking about areas in the chin and the jawline as well. Let's get right into it. Now, traditionally, Botox or Dysport or Xeomin or Jeuveau, as you've heard about, usually are used for your forehead lines to relax those lines from animation. So when you raise your forehead up, I actually need mine due soon as well, or when you're smiling real big around the eyes called the crow's feet. But there are a lot of other places where these can help too. So let's start with the first one. When talking about doing any of these toxins or neurotoxins, it's always important to discuss the anatomy of the area we're treating. If you look at this diagram here, when we're talking about the forehead lines and the glabella or in between the eyebrows, we're treating these muscles here. The frontalis muscle on top and the corrugator muscle and procerus muscle in the middle. Once we help with the toxin into that area, it helps to relax that muscle so we don't make those lines. And this is typically used in this patient here in the glabellar complex that we talked about. It does a really nice look of relaxing those muscles, so when they try and squint or make that angry look, it really gives it a nice pleasant appearance there. Similarly, when you put it in the forehead, this is the most commonly used indication for the neurotoxins. You can see it gives a very, very nice relaxed look without looking overdone or kind of that fake appearance that people might think is associated with Botox or toxins. Looking on to the next picture here, talking about the crow's feet. So there's a muscle around the side part of the eye called the orbicularis, and this is what we target when we're treating that crow's feet area. So in this young lady here, when we smile, we animate. This is normal. We all do this, and we start to develop these little lines. And I always give the analogy of a piece of paper. So if you crinkle a piece of paper and you try to uncrinkle it, you're always going to see a little line there. So in a way, it is kind of nicer to do these things as a preventative measure to prevent the lines from being etched in. Moving on to the next part of the areas where we can do neurotoxin is the nasalis muscle, or the muscle around the nose. And this helps with these things called bunny lines. So if you see in the top picture there, when we have people squint up or laugh, a lot of people make this line. You may not even notice it. You may look in the mirror and start laughing or smiling, and you say, hey, I kind of have those too. Botox or any of those neurotoxins are a great way to do this as well. Moving on is an area called the depressor nares. So this is a muscle that's right underneath the nose here. And actually, it's interesting. A lot of people don't do this. It's very subtle, but it can give you a slight elevation of your nasal tip, and it is kind of a subtle look. Really nice conjunction with non-surgical rhinoplasty with filler in the right hands. Moving on is the gummy smile. This is probably one of my most favorite areas to inject because it can really make a difference here. The areas we're targeting here are the levator labii superioris muscle, and this is really the area that has a kind of a mesh of three different muscles coming together, and we try and target that sweet spot there as well. So in this photo, you can really see a difference. I'm sure you guys know people that have smiles like this. They're beautiful. This just really helps to augment and make that smile more natural and have a little bit less of gum show. Moving on to the lower face is the smoker line area, or the area we're targeting is the orbicularis oris muscle. So this is the muscle when contracted causes all those little smoker lines. Now you may have never smoked a day in your life, but from talking throughout the years, sipping from straws, these things can happen. We all get this, but a nice way to help treat these lines is with a little bit of touch of the neurotoxins as well to help kind of, it's not 100% grand slam, these lines are gone, but it really does help to relax those lines. Again, great in conjunction when you're doing lasers or fillers to really give that softened appearance. Moving on, another area we commonly like to inject is for people that have a dimpled chin or an orange peel appearance chin. So we target the muscle here called the mentalis, and that helps to kind of give that subtle appearance of a relaxed look, as you can see from this photo. It does make a huge difference, I think, if done in the correct place. I do caution here, there is a muscle that is just next to this that if you can hit that, it can cause a little bit of a droopy smile. So again, you want to go to an experienced injector to do this because it does require a lot of precision. Moving on to the next area is the frown lines, or they like to call it the RBF face area. And this helps a lot to relax those people that have kind of a downward turn smile. And we're targeting the depressor anguli oris muscle here. Again, this can be felt if you want to, put your fingers onto your face and show your lower teeth or make a sad face. You can feel that muscle there, and that's what we're targeting there. So in the photo here, you see a really nice result from that person. And again, it's very subtle, but you can see a little bit upward turning of the smile lines. And moving on to the square jaw appearance. So I'm sure you know some people that have a square jaw. This is a lot of times from hypertrophy or increase in muscle density of the muscle called the masseter muscle. A lot of times people have problems with this too from grinding their teeth at night. They can get something called temporomandibular joint disorder, and this is a medical use too of using these neurotoxins to help relax that muscle so they don't grind their teeth as much. But in addition, doing it repetitively causes atrophy of the muscle, which actually slims the muscle down. And you can see they took advantage of this and they made it an aesthetic use. So in this person over here, really square jawline at baseline and after doing neurotoxin, really nice look. Bethany Frankel, perhaps she had this. I don't know if she did or did not. A lot of media outlets are saying she did, but if she did, I mean, this is a beautiful result, I think, for her, more natural. And finally, another area we like to do neurotoxin is the platysmal bands, or the muscle in this whole area of the neck called the platysma. Really nice to soften the appearance of those bands. Now, a lot of times when we're smiling, someone makes you laugh, you get a big smile, you can kind of start seeing these lines. You really have to exaggerate this look to see that, but you can really get a good result with just a little bit of neurotoxin, again, in the right place. Some of the most common areas where you can do Botox or any of your other favorite toxins, again, they're not necessarily on label for all these areas, but as physicians, as expert doctors and nurses and people that have expert training in this, these are areas that can be injected in the right hands. Not necessarily on label, but as physicians, we do things off label often. But again, you have to know the anatomy. You need to know the muscles that do these things. So anytime you are going to get an injection, make sure your injector is qualified and knows the area and the anatomy. So if you guys have any questions about any other areas you've seen or heard of Botox or any of these done, leave a comment down below. I'd love to hear from you.